Set 11 listings technical question and answers. Answers are highlighted in green. Question 1. Understanding the purpose of listings. A clinical trial team is reviewing a listing of adverse events before finalizing the clinical study report. The listing includes subject level details such as severity, relationship to the drug, and outcome. What is the primary purpose of generating such a listing in clinical trials? Option A, to summarize aggregated AE counts across treatment groups. No. To perform statistical inference on AE rates. Now here the statistical inference, what they are talking, there is nothing called as p-value in this subject level details, right? So the answer is wrong. Option D is to replace safety tables in the CSR. Now this question is asking about listing includes what and what is the purpose, right? So the replacement of safety tables is not at all possible. So the correct answer is B, to validate the accuracy and completeness of individual AE data. Question 2. Listings, format and structure. A sponsor requests a concomitant medication listing for a phase 3 oncology trial. The listing should include subject ID, drug name, start date, stop date and indication. Which of the following is the most appropriate sorting order for this listing? Now option A says drug name, subject ID and start date. Now this does not give a clear picture, right? Even though option C says start date, drug name, subject ID. Now the subject ID is mentioned in the last. Okay, so which is not the correct sorting order. Option D says indication, drug name, subject ID. This is also not the right answer. It says the listing should include subject ID, drug name and start date, right? So the idea here is to sort the listing by subject ID first, then by start date and then by drug name. So this listing will give you the review of all the drug names that have been started by a specific particular subject. I don't want the subject numbers to be repeated, in different indications or different page numbers. In only one page, you will want to see the subject ID, start date and drug name. So this kind of structure, it becomes very easy for the reviewer for doing in the efficient way of reviewing. Question 3. Handling missing data in listings. You are reviewing a listing of vital signs for a clinical trial and notice that some subjects have missing systolic blood pressure values. How should missing values typically be represented in clinical trial listings? Option A, leave the cell empty. No, you cannot leave the cell empty. Use double nine or another placeholder number. You cannot even use any kind of placeholder in clinical trials where you are dealing with the human patient's data. Option D, remove the entire subject from there. Definitely not. Even if the systolic blood values are missing, you cannot remove the entire subject because suppose this patient has died and the systolic blood pressure values are missing due to so and so reasons. So if you have missed this record, that means you are completely removing a death patient in a particular clinical trial, which becomes typically unethical. So it will raise an alarm if when the regulatory ethics, if they come to know. So hence you cannot remove such kind of values. So you need to use NA, not applicable, or a predefined missing value code. So the correct answer is C. Question 4. Sorting order in adverse event listings. A regulatory agency requests an adverse event listing that allows easy identification of serious adverse events. Which typical order is typically recommended for listings? Option B, A, start date, severity, subject ID. No. The subject ID is mentioned in the third position, which should not be. It should be in the first position. Option C says severity, subject ID, A, start date. Not the right order because generally we present subject ID in the first place. So this is not the right order. Option D, A, start date, subject ID in relationship. This is even not the right answer. The subject ID is in the middle. So the correct answer is A, subject ID, A, start date and severity. So this order, what it does typically, it will give you a particular subject ID. That subject ID had how many adverse events, start date, and out of those start dates, which are the severe concerns, like how many are serious adverse events. So that information will ideally pick up that particular subject and it becomes easy for a regulatory agency to review. Question 5. Custom listings for data review. During a data monitoring committee review, the team requests a listing that flags subjects with a weight loss of more than 10% from baseline within the first 8 weeks of treatment. What is the best approach to designing this listing? Include all subjects, highlighting those with 10% greater than weight loss. No. Option C, exclude subjects with missing baseline data. Now, even if the baseline weight is missing, you cannot even exclude those subjects from the analysis. Option D, create separate listings for each treatment group. No, you can't even create a separate listing. It has to be in that specific listing, whatever that domain is. So the correct answer is list only those subjects meeting the greater than 10% waist loss criteria, because the DMC wants to see only those patients who have lost the weight of more than 10% from baseline. So they are interested only in this number of patients. Question 6. Listings for protocol deviation. A clinical trial includes a protocol deviation listing to track subjects who missed visits or took a prohibitory medication. Which of the following details should be included in the listing? Option A. Subject ID, type of deviation, severity and corrective action. Option B. Subject ID, protocol deviation number and reason only. So this is not the right answer. Option C, subject ID, visit dates and total number of deviations. Now understand one thing, the total number of deviation does not give the clear picture as to what is the deviation description or what is the details of the deviation. So option C is not the right answer. Even the same goes here, it says subject ID, protocol deviation number and only the reason. But the actual protocol deviation descriptive is not there as to why that particular patient deviated from the milestones of the protocol scheduled terms. Option D, protocol deviation description and severity only. Now again option D is also not the right answer, because here you have the protocol deviation description and severity, but it does not include the unique subject ID. So how can you know that this particular deviation is for which particular subject ID? This is how you need to understand the options whenever you see such questions and you try to attempt these kind of questions in any kind of test or in any kind of examination. Your logic should be clear. Once you have understood the concepts and once your logic is clear, everything will fall in place and your answers will be correct. So here the option A says subject ID, type of deviation, severity and corrective action. So this is the right details, because this will give you the bunch of those subjects who have missed the visits, understanding as to how severe that deviation was and how type of deviation it was and what kind of action the specific principal investigator did for this particular patient who missed the visits. Question 7. Listings in SDTM and ADAM datasets. You are asked to generate a listing based on adverse event dataset. Which of the following variables would typically be included? Option B, plant treatment, visit number and value. This is not the right answer, because we do not know the adverse event description and we do not know the severity, right? Only the visit number and plant treatment and value is not going to give you any kind of information, right? Option C, medication name, start date and dose. Now this is irrelevant because we are talking about adverse events. Now it doesn't make sense for providing listing of concomitant medication when you are asked to do the listing for the adverse events. Option D, vital signs, value, study day and origin. Now even this is also a relevant option, because we are dealing with adverse events and not with vital signs domain, right? So this is an irrelevant option D. So the correct answer is A term, A start date and A severity. Question 8. Review of lab listings. A sponsor requires a lab listing highlighting abnormal laboratory values based on predefined reference ranges. Which approach is best for identifying abnormal values in the listing? Option A, compare values against historical trial data. Now, what kind of historical data that you will compare? This is irrelevant based on the study. Option C, include only values that change significantly from baseline. No, you have to include all the values. Exclude normal values and show only high and low values. No, even if you are presenting the shift tables, like how many patients they deviated from normal to high or normal to low or high to low or high to normal, right? So those kind of scenarios we need, especially in the shift tables. So hence the correct answer is option B. Use the lab reference range and flag values outside the normal range. Question 9. Listings for data reconciliation. A clinical trial database has discrepancies between the concomitant medication listing and the adverse event listing, where an AE lists a medication as a treatment, but it is missing in the concomitant medication dataset. What action should be taken to resolve this issue? Option A, remove the AE. No, you cannot remove this AE listing, because it is very important that the data is present in one domain but it is not present in the another domain. So you cannot remove the AE from the listing. Update the concomitant medication dataset manually. No, you cannot even do any kind of manual updation in the database. Option D, ignore the inconsistency if it is not severe. No, like I said, in clinical trials where we are dealing with human patients data, you cannot remove something which is missing. You cannot even update manually, and you can't even ignore if it is not severe. Whatever it is there, even if it is not severe, that thing has to be mentioned. So the correct answer is C. Investigate the source data and query the site if necessary. Question 10. Listings output formatting. A sponsor requests that a listing be provided in both Excel and PDF formats to facilitate different review processes. Which of the following best describes the purpose of each format? Option A. Excel is for final submission and PDF is for internal review. No. Option C says PDF allows modifications while Excel ensures a fixed layout. Well, this is completely vice versa. PDF allows fixed layout, whereas Excel, it allows you to make any changes. So it's a vice versa statement here. Option D says Excel is the only format required for it. No, it is not. There are many formats that the regulatory agencies they expect, especially XPT files, then define.xml, then PDF files, so that nobody can make any changes, and those files are read only whenever you do the regulatory submission. So option B says Excel allows filtering and sorting, while PDF ensures a fixed format for regulatory submission. So the correct answer is B. Please like, share and subscribe. Leave a feedback comment mentioning any topic that you want me to make a video. Looking forward for a positive response. Thanks for watching. Please like, share and subscribe. Leave a feedback comment. Many thanks for your support and having great connection.